Right.
Okay, gents, thank you very much for this. Really appreciate it. We've got Dr. Olusegun Adetunji here to talk to us about cancer in men. So I'll hand over to him right now and to start the presentation. Please hold your questions till later, as discussed earlier. Thank you. Doctor, you can start.
Yes. Good evening, gentlemen. It's a privilege to talk to you guys today about cancer in men. By background, I'm a GP partner with my colleague there, Dr. Fatai, and I have a background in surgery. Currently, also, I'm working on being a training in education. So that's my background in a short while. Now, cancer generally, as we know, is one of the main killers worldwide. Whether you're a man or a woman, cancer is a killer. And it's a scary word. When you hear cancer, everybody go melting. And so I think it's important for us to have a good understanding of it and see what we can do as an individual moving forward. First slide, please. Second slide. Right, as you can see in there that most common cancers among men is lung cancer, and it's about 15.5% of the whole cancer pathway. And then the top three cancers that we know of that affects men are lung cancer, prostate cancer, colorectal cancer, which accounts for about 44.4%. And then the top five worldwide, lung still takes the first one, followed closely by prostate, colorectal cancer, bladder cancer, melanoma, which are the skin cancers. Now, the prostate, which is primarily for men, has some risk background. Your age, we are all over 50s now, so definitely we're in that category. Ethnic group, the Black ethnic group actually have higher incident rate for prostate cancer. Again, we're in that risk group. Family history, if your father has got history of prostate cancer, then you got to be on the watch out. Obesity, again, contributory, and diets. High calorie diet. Most of our African diets are high calorie diets, and so we've got to be very careful. And again, food in cancer genesis, red meat, processed meat, which include bacon, ham, salami, etc., etc. Next slide, please. Now, when you look at cancer, a few things can be contributory. I don't want to use the word cause. I want to say contributory factors, which include biological factors or internal factors. That is age. Like we said, the older we are, the more prone to cancer will become. Though saying that, there are a lot of cancers that are, affecting younger generations. And in the last couple of years, you find out that cancer now has actually breached these, bridges that anybody could be affected by any form of cancer. So gender, definitely we talk about prostate, is primarily a man, it's a male gender, cancer in his own pathway. Breast, more common in female, but men too do have breast cancer. So we've talked about inherited genetic defects, that you cannot have that at all, or the skin type. Again, the black, skin make up prone to certain things. Environmental factors, exposure to fine particulates matters, UV radiations, too much of sun is not good for the system. All these are very, very important. Occupational risk factors. Some people are exposed to a lot of things. If you work, in radiation industries, if you work some chemicals, if you work with asbestos, and then you can be exposed. And interestingly, in Nigeria today, it is still a thing for us to use asbestos in building. Meanwhile, in developed countries, this has been done away with ages ago. So asbestos is no longer part of their building system in here, but in our system, it's still a major pathway of building. Lifestyle, I think here we need to be a bit more interested. Smoking, diet, physical activities, overweight and obesity, physical inactivities, diet, which include frying, broiling or grilling, processed meat, low vitamin D, smoking, and alcohol. All these can contribute immensely to cancer. Next slide, please. Next slide, please. Right. This actually will look at prostate. If you experience any of these symptoms, please, I will expect you to do something about it. If you suddenly notice blood in your urine or in your semen, semen is the sperm that we talked about. So if you notice, inconsistency in those things, you need to be wary. When you pass urine and then you still feel like you are not emptying enough, you got to be wary. Or suddenly you find out that you struggle to empty your bladder, very weak flow, dribbling, and things like that. It's very important for you to get yourself checked. Straining, when you get to the loo and it takes minutes before you can start going, and when you start going, you find out that you can't really point forward. It's all dribbles. Then you got to be careful. You got to get yourself checked. Hesitancy, when you hesitate, when you get in there and it takes ages and ages to go. Then peeing at night, you wake up 3, 4, 5 times in the night to wee, then that is not adequate. You need to get checked. Weight loss, bone pain, or erectile dysfunction. You've been very active before, and suddenly you notice that, oh, this seems not to be actively working anymore. You need to get yourself checked. Or you find out that you start rushing into the toilet. Wherever you find yourself, you can't really hold anything anymore. You have to go when you want to go. Then that means you need to get checked. Next slide, please. Now, this will talk about lung cancer. Any coughing that is ongoing for more than 3 weeks, please, you need to get yourself looked at. If you notice blood in your mucus, that is whatever you cough out, then you need to also get checked. Painful breathing, aches and pains, this actually needs checking because that could suggest something going on in your lungs. Then sudden breathlessness. You do a bit of short walking and you start panting. Or you've been running miles before, and before you run a mile now, you start struggling. These are things that you need to take cognizance of and act very, very fast. Tiredness. And then, tired all the time or lack of energy. You've been up and going all the time, and you find out now that you struggle to do your basic, activities of daily life, you're struggling, then you need to get yourself checked. Next slide, please. Now, the colorectal cancer, this is a very big one. Now, you should know your bowel habits. What that meant is that you should know, I go to toilet once a day or twice, a day or 3 times a week. Suddenly you notice that now you go to toilet almost every day and more of a loose stool. It doesn't have to be you going for diarrhea every minute of the day. Once you notice that there is change in your pattern, then you need to get yourself checked. Or you notice that your stool becomes like a pencil, very narrow. You used to have a very bulky stool before, so suddenly it changes to a very narrow, pencil-like thing. You need to get checked. If you notice bleeding from the back passage, it's a thing that you need to be worried about. Blood in your stool, sometimes it could be dark. Again, that's not a very good sign. You need to get yourself checked. And sometimes you go to the loo after pooing, you still find out that you feel you need to go again. Then you need to get yourself checked. Or suddenly you find out that you are not making any effort to lose weight, but just find your weight dropping unexpectedly. Then please get checked. Abdominal pain or bloating, unexplained, this tummy just achy, or you just feel full all the time. Before you eat anything, you feel full, please get yourself checked. Or suddenly you notice that you start feeling very nauseous, not necessarily vomiting, but you just feel very nauseous. Please, and please, it could be a sign of something ongoing. Next slide, please. And this pancreatic cancer, though this is not a common thing, however, it's a killer because it's peaked very, very late. And by the time we get to know about it, it's already gone very far. So please, you notice yellowness of your eye, which we call jaundice, then you need to get checked. Or you find out that you are a very good eater, though you don't eat heavily, but you eat very well, and you suddenly realize that you now don't have appetite at all, and you are losing weight, please, you need to get checked. Again, lack of energy, lack of drive, feeling tired, this could be a sign of something underneath. Feeling hot or shaky, which you call shivery, again, that is something you need to be thinking about. Or back pain, particularly upper back pain, more from the front to the back, then please be wary of such things and please get yourself checked out. Next slide, please. Now, gastric cancer, again, poor appetite, I could describe it, weight loss unexplained, abdominal pain, particularly upper part of your tummy, vague, disruptive. It could just be, wake you up from night, you can't sleep properly, just gnawing. This annoying pain is just there. Please get checked. Sense of fullness in your upper abdomen after a very small meal. You can eat well before, you eat very good, amount of food, but suddenly you find out that a little mouthful keep you satisfied quickly. Then please get checked. Nausea, vomiting, with or without food, very important. Heartburn and indigestions, please, there might be something going on. Not necessarily cancer, but if you experience any of the symptoms, it is important for you to get checked. Next slide, please. And the skin cancer. Well, this also, there are some of them that are very, very mild, but there are some that are very, very nasty. Melanoma is a very nasty disease if it is not picked up early. How do we know? If you notice any discoloration in your skin, we that are black, we got to be very, very, very careful. We may not notice this early, but please be on the lookout. And you notice this discoloration in your skin, which feels crusty or bleed or at a touch, then you need to be wary of it. Or any painful lesion that is itchy, burning, then please get yourself checked. If you notice any change in the shape or the context of the lesions, it could be in terms of structures or regularity of the border or sudden change in color, from pink, white, blue, or black, please get checked. Or you notice a sudden large brownish spot with darkened speckles on it, then you need to think about this and get yourself looked at. Next slide, please. Now, we've looked at cancer as things, but what are those things that we can do as an individual to help reduce the incidence of these cancers that we talked about? We've talked about prostate, we've talked about skin cancer, we've talked about colorectal cancer, we've talked about pancreatic cancer and cancers. Are there things that we as individuals do? I think there are a few things that we can do on our own self to reduce the incident. We may not be able to completely prevent, but we can reduce the incident. Those who love smoking, I think there's a very significant relationship between lungs as well as smoking. So smoking is very, very important. Balanced diets, fruits, vegetables, very, very important. This is to boost your immune system, to help reduce some free radicals that could destroy cells in the body. So they're very, very important. Exercise, we cannot overemphasize that at all. Maintaining healthy weight. Fats, obesity has been linked with a lot of cancer. ranging from breast to colorectal to prostate. So maintaining a healthy weight is very, very vital and pivotal to, preventing a lot of things happening to us. Then alcohol, if you have to drink, it has to be in moderations and very, very important. Yes, adequate rest. I know we want money to pay bills, to do this, to do that, to send kids to school, but most importantly, if we work under a lot of stress, there's a lot of free radicals that could damage your cells and affect things. So adequate rest is very important, and avoiding infections, hygiene, good cooking habits, cooking meat thoroughly and eating very nice food. Next slide, please. Right. So we have looked at cancers, how we can boost immunity. Now, how can we prevent? We've got 3 levels of prevention here. We've got the primary preventions, which is in your hand as an individual. Then we have the secondary, and then we have the tertiary, part of it.
Please, can you go on mute if you're not talking?
So the primary one include health counseling and education, which involves what we've talked about, knowing what symptoms are, being active, rest very well, good food, maintaining good weight and good lifestyle as it is. Now, product safety. I'm not sure how many people listened to the news this morning when they were talking about Coca-Cola and sugar intake. There were a lot of evidence that suggests that sugar intake is, it is a killer, particularly with the obesity. But Coca-Cola has gone into, the system to, pull out a lot of studies to show that actually it's only exercise that is required for you to live healthily. But information and evidence suggests that if you still take a lot of sugar, then you might be negating what you are burning, what you are doing in, activity. So some of these products that are being marketed to us that we buy over the shelf could be very detrimental to our health and safety. Now, environmental control, we're all talking about, gas emissions and stuff like that, pollutions, they all contribute to these problems. Environmental control and exercise, like I've said. Exercise is very important for us as individuals to keep our health healthy, to reduce a lot of hormones that keep us happy and going, reduce free radicals, and help to maintain muscle tones and burn out a lot of fats. And last bit there is diet and immunizations. We take, diet as a factor that, to take the, amount that is essential and adequate and not too much of, processed food. Then immunizations is a form of primary prevention. Then the secondary ones, including screening. There are a lot of screening things that are done for cancers, but prostate particularly, we don't have any screening, pathway for now. However, if you notice any of these symptoms, you can request a PSA, which you call prostate-specific antigen, from your GP. Though it is not a diagnostic screening test, but if it is positive, it could linger on to some other tests to be carried out. But like I said, it's never been approved as a screening tool, but it's something that you can pick on to do. There are early detections. How do you detect if you don't look for it? And so that is why it's important for you to take your health very seriously, get screening done when it is necessary. When you see any symptoms, get yourself looked at. And that will involve the secondary prevention. Then the tertiary one is care that is aimed at reducing morbidity and disability in people that have been diagnosed with, excuse me, with cancer. So I'm going to end up with that Cancer is very, very important. We need to make effort to prevent it. Thank you.
Thank you very much, Doctor. I just want to